And we are live. Hello. Welcome to the We Can Be Zero, hosted by Galway Can Be Zero panel chat. We're very excited and very grateful to Deputy Catherine Connolly, to Aoife Moore, to JP McMahon, to Liam de Brún, to Olive O'Connor and to Ciara Ní É for giving us their time today. Our main message that will be ticking along the bottom is we would love you to help to share and to amplify our message, to follow our pages on Twitter and Instagram and Facebook, obviously, where we're broadcasting from. And thank you for coming to watch, and thank you all panelists for joining us. And I will leave you in the capable hands of Deputy Catherine Connolly, who needs no further introduction because this is Galway and we all know Catherine Connolly. Catherine, thank you so much, and you can take it away.
Gur míle magat Susan agus the Sinead freisin agus bhí Jackrucht eki mise all done law and you, so gur míle magat Galanchif Araya Brún. You're very welcome, and I want to thank Susan and Sinead. And Sinead had a job trying to pin me down, and she finally pinned me down till today. I'm not going to talk. I think it's important. We have 5 speakers here. Just to say, I want to re-echo the words of Sinead in terms of we could give our hands up and say it's too late. But really what strikes me as a TD is the fragmented way that we have approached this pandemic. In the beginning we were learning, but we're now a year and 2 months afterwards, and information has become more and more fragmented. And every week we have different updates with no overall discussion as to an overall pathway out of it. That's done by press releases outside of Dáil Éireann. That's worrying. It's also particularly worrying that we haven't dealt with intellectual property rights, and we're watching horrific scenes from India and other countries. And again, we can forgive ourselves for not doing that initially, but at this stage there is no excuse for not coming up with a solution to intellectual property rights. The companies have intellectual property right is there to protect a company in the sense of stimulating a gap in the market. There is no gap in the market now. We've given an indemnity in relation to side effects. We've given public monies, and there's constant demand for vaccination. So all the risk has been taken away. So I just confine my comments to that. But it's certainly, I'm delighted that we're here looking at Galway Can Be Zero. It's really important. And having said that, there are 5 speakers within this hour, and the first speaker I want to welcome, Aoife Moore. And I know, Aoife, you'll be leaving us shortly, and I want to say, Céad Míle Fáilte, you're a patient advocate from Long COVID Cases Ireland. You're living in East Galway, and you're here to share your experience of COVID-19. And thank you very much. And I know it's not easy. It's not easy doing it through this mechanism. But gur míle magat.
Thank you very much. Yeah, that's exactly it. I'm just here today to kind of share my experience, to explain kind of what happened to me, and I suppose why it's the impact that it's had on my life and many others. So I suppose I'll start at the beginning. I first contracted COVID, or first started becoming unwell with COVID back on the Friday the 13th of March 2020. So to bring you back to that time, I think that was the first day that the schools were closed. There was no cases in the West that we were aware of. You couldn't find PPE anywhere. You couldn't find hand sanitizer anywhere. People, were we didn't really know the effect that the following year was going to have on us yet. I first became very unwell. I went to my GP. GP didn't feel that I wasn't a healthcare worker. I hadn't been outside the country. My movements weren't bizarre or anything like that. So he just didn't feel that this was likely, but he sent me for a test anyway. There was delay in testing at the time. But eventually when I did come back on the 8th of April, it did conclude that I was positive for COVID-19. Now, unfortunately, I suffered the effects of that. I'd say the first 3 weeks were the most harrowing. After that point, it just didn't go away. And while, yes, it has improved, and I think the improvement that has happened is because I have learned to, deal with it and kind of learned what's best for my body. And so I've kind of figured out a way to kind of work with it. and that's why it's improved. But ultimately, I still have many of the symptoms, and I'll just go through a few of them, what I currently have at the moment, which is the most debilitating for me is the chronic fatigue. And I suppose what I would like to explain what chronic fatigue is that while I'm sitting here speaking to you, if you were to put your hands out in front of you like so, and if you were to keep them up for the entire time that you're talking, eventually, you'll start feeling, they'll ache, they'll get heavy, you'll want to drop them. But imagine you can't. And so that's what it feels like to me. The minute I go from a lying position up to seated, I'm working on seated. But once I stand or once I walk, that's when it just gets, so it's a muscle, it's a body issue. It's not tiredness, which people sometimes confuse it with. It's a body tiredness. So that is the kind of the main debilitating thing that I am kind of working on, because I have to every morning wake up and do a body scan and decide what am I capable of today. And that could be as little as having a shower. I make commitments like I did for today, and obviously, it's difficult for me to do that because I can't look too far into the future, because it literally depends on how I'm feeling that day. With the chronic fatigue, because I constantly feel like I'm keeping my arms and my legs up especially, it means that I have a lot of pain. So that builds throughout the day. So as soon as I wake up in the morning, and as the day goes on, by the time it comes to nighttime, the pain is something, it's quite severe. So that's when I take medication for it to help me sleep. And let me tell you, it can be a very lonely night sometimes. And sometimes I just be there and just waiting for 6 hours to pass so I can take another paracetamol, or just waiting for daylight to come so that it doesn't feel so lonely. Do you know what I mean? The dark is before the dawn kind of thing. So I mean, that is quite regular for me. The other things obviously was the cough. The cough has gone away an awful lot, but I do have what you call relapses. So if I push my body too far, I'll get these relapses of symptoms, and I'll get the cough coming back. I cannot watch anything too sad. I cannot watch anything too funny, because if I laugh, or cry too hard, it'll bring on the cough and I won't be able to breathe. They have done CT scans on me, and they can see that there's kind of damage in the lower part of my lung, which is kind of where I feel it's like 2 knots. Again, depending on the day, it can be better or worse. I have a lot of pain in my chest when it gets bad. I get this thing called costochondritis, a lot of inflammation in my body, in my joints, in my chest cavity. They can see that in my bloods. They can see a lot of things, but I suppose it's a very complicated thing to have. It's a whole body thing. I have issues with my heart rate. I have issues with brain fog, which is why I'm looking at these notes all the time, because obviously when I'm focusing so much on being upright or doing a particular task, that's where all my energy goes to, which means it's difficult sometimes for me to kind of process things that's going on in my brain. That has had an effect on me in that I've gone back to college, and I've gone back to do a postgrad and I'm doing maths. Now, the issue with that is I've had to kind of half that course, because they were very accommodating down in UL. They were wonderful. Because mentally, I just cannot keep up. Even though it's a part-time course and it's online, I mentally just couldn't keep up. I loved it, and I was really upset thinking that I'd have to give it up, because it was just like, it felt like another thing that COVID had taken away from me. But they were quite happy to adjust it. So I'm still in the course, and I'm still just did my exam the last day actually. So I suppose they're my current symptoms. They're kind of the worst of them. There are lots of other small ones like sores in your mouth and whatever else, and stomach issues and all other little things. I have a whole drawer full of medications depending on what's going on. But that's not just, okay, if that was just me, affecting just me, I'd say one thing, but it affects me and my entire family. So I'm married to Carl, and we have 2 kids. They're nearly 6 and 4. And my youngest is, when I got sick last year, a couple of months later, he got diagnosed with autism. And I effectively was his carer up to that point, and I just disappeared off the face of the earth because I was in the room so ill, in bed, bedridden constantly. And, he kind of regressed, and that was really difficult for him. So the mammy guilt, as you call it, or whatever you want to call it, of being unable to parent my children. Myself and my husband, we used to be a team. we're no longer a team. He's responsible for the school runs, the food, the shopping, the cleaning, everything. And it's very hard, to sit back when you desperately want to live and not just exist. I'm getting a little bit emotional now, obviously, when you talk about my family, but it's not easy. And I suppose the reason that I'm here to speak today, and I suppose we'll get to the crux of it, is that, yes, I am a very severe case. I do recognise that. I recognise that, there's not a lot of study done. There was a study done up in Trinity, but by Liam Townsend, but that was very small sample size and only that particular hospital. But over in the UK and over in the US, they have done some studies. Again, it's all very early days, but roughly they say that people, up to 20% of people who get COVID will have some form of long-term symptoms. Now, they mightn't have the litany of stuff that I have. They reckon about 10% will have severe in certain aspects. So that would be where I would kind of fall in. But I mean, if you look at all the people who have gotten COVID in Ireland, that's a huge amount of people. We need a response. We need an individual healthcare response to long COVID. That is what I'm here for today. That's where the patient advocate point comes in. It's very hard sometimes when you are sick to try and push and advocate for yourself. So I was very lucky to find a group of people, Long COVID Cases Ireland, where there's over 2,000 members in there and growing all the time. And, they basically are kind of a place of support to people who get it. And, they could kind of, say, have you tried this? Have you tried that? And various, refer you to various different, people who might be able to help you. But the thing is that with me is that I have so many different health issues that what it needs is one comprehensive, holistic, multidisciplinary team to look at me. And that's where these long COVID clinics, come into play. Now, at the moment, they are being set up. I do have to say that about the HSE. The HSE are setting them up. But they're not, I suppose it could be a little bit faster, or it could be a little bit more throughout the nation, do you know what I mean, nationwide? Because at the moment it seems to just to be in Dublin or just to be in Cork. Galway has recently opened and I have attended them. I found them wonderful, and there I found them, they listened, and that's it, they listened. I find a lot of the time patients aren't really listened to. It's fobbed off and kind of moved to a different department, and I'm not really sure what to do to there. But there was a multidisciplinary team in there with physios and OTs and general physicians. They referred me on to respiratory consultants. They referred me on to rheumatologists. They looked at me as a whole person and this condition as a whole person with all the knowledge that they had, and they came up with a plan for me. And I felt finally, that was March and April, and I felt finally that I was heard and I was listened to. But honestly, I do feel that only comes from having the support of those people who are in Long COVID Ireland. Having, we're constantly in the media and in the press, explaining our symptoms, telling our story, trying to feel heard in the wider kind of, and where it might actually matter. So especially in terms of, other than just getting press recognition, to getting, maybe some kind of political support kind of behind it. And that's kind of what we need really, is someone to kind of, I suppose, speak about it in the Dáil, or, take it on board as a party, have a look at the policies, kind of work with the groups. I mean, there are fantastic people in the HSE, who are willing to work and help. And, if we could all get in one room and kind of work together, that would be wonderful. So I believe that my time I've gone way over. I'm sorry.
That's okay. That's okay. Yeah.
I'll just wrap up and just say that this is a very real condition. It has very real effects that are long, affect more than just the individual person, and therefore it needs an individual response. And I hope that forums like this can help bring about that. So thank you very much.
Thank you very much, Aoife, and don't worry about going over time. I think it was good that we started with you, that you've given us a perspective that needs to be looked at. Thank you for doing that. All I can do is agree with you and hopefully influence a few other people. And it's something that we need to look at in the Dáil. And it goes back to the segmented nature of our discussions, which is forgivable for a little while when there's an emergency, but not on an ongoing basis. So, Garamila Mahaga,
exactly.
I know that you're going to be leaving us, and that's okay. And thank you very much. That wasn't easy. Thank you. And I should have said at the beginning, moving on now, just in terms of time. Thank you, Aoife. There are 4 speakers left, so perhaps if I say 6 minutes each, and I give you a warning at 5 minutes, if you want less, that's okay. But so 5 minutes each, and that'll leave time then for discussion at the end. So the next speaker, Olive, is with us. So Kid Mila Falcha wrote Olive. This is Olive O'Connor, and she's a member of the Independent Scientific Advocacy Group, which has done great work, and a member of Parents United as well. And you've worked for many years in international healthcare as an advocate and a citizen scientist. Olive has 2 international fellowships, is a reviewer with the BMJ, and has been presented with numerous awards and accolades for her own research and innovation in the healthcare arena. During the pandemic, Olive has specifically focused her research and advocacy on public safety and equal rights, which is extremely important, especially for children, families, students, and school staff. So I'm going to start the clock, Olive, 5 minutes, and I'll give you a warning at the end of 5 minutes.
Thank you very much, and I'm delighted to be here today. I suppose listening to Aoife's journey has brought me back to a place where we once were. So I suppose I started my work in advocacy and equal rights, specifically around healthcare, because of our own family history. So I have 4 children who all have complex healthcare needs, as does my husband. Back in 2009, myself and my 3 older girls all contracted swine flu. The girls came back from school with swine flu. So for those 3 weeks while we were very sick, it was absolutely horrible what they went through. Afterwards, I didn't realise the impact that would have. So 2 of my girls have been left with debilitating symptoms well over 10 years now, still have them. One of them in particular has gone through an absolute nightmare. So nearly everything Aoife mentioned there in post-viral with COVID, my girls have gone through. So when you talk about chronic fatigue, I had a 9-year-old who couldn't get up in the morning, couldn't get dressed. She had to be put on methotrexate because her joints were so inflamed. She had costochondritis. Nearly everything that Aoife said there is what my child went through and still goes through, although it's a lot better managed now. So that kind of, I suppose, I've always had a focus on post-viral, I suppose, conditions since that time, and I've been very interested. And back in February 2020, when we first learned about this virus, I was immediately thinking of children's schools, and schools being an area where viruses can spread very quickly. So I really empathise with Aoife and all of those people. Aoife is correct in relation to the amount of people that get long COVID in and around. So it ranges between 12% and 20%. Now, if we were to think about that in cases of, like, just say numbers, we've had over 250,000 cases of COVID in Ireland. And you look at 12 or 20% of that, that's a hell of a lot of people that could potentially be left with debilitating symptoms. So a lot of the time in our pandemic, we focus on our acute hospitals right now, and obviously preventing an overwhelming capacity issue with our healthcare system, and rightly so, because we've had a very poor healthcare system for many years. But if we think about long COVID in medium to long term perspective, we're looking at the impact on not just our acute systems for patients who have to go in and essentially have tests and diagnostics and MRIs and CTs and bloods and so on and so forth, also our primary care system. And that's why we need to do everything we can to prevent that. As I said, I've been focusing a lot of my time during this pandemic on children, young people and families and equal rights. Because we are a high-risk family, I learned that there was a big issue at school. So if you were a child with a very high-risk condition, you were entitled to remote learning. But if you were a child with a high-risk condition and didn't meet that category, you were basically asked to go to school. Even if you had severe anxiety about going to school, you were told you had to go to school. The other option was to deregister your child from a roll book, which meant that you would officially homeschool your children, which obviously has a huge impact. There's a lot of families that can't afford that, nor do they have the capacity to do so. So this is where the equal rights side came in, and obviously preventing and protecting people's physical health. So what I've done is worked with a group called Parents United and Forgotten Families. These are groups that have literally been forgotten about, where they live with family members who are also very high risk themselves, but their children basically have to go to school. So I suppose when we look at kind of the policies and everything in our healthcare system, we need to think about how many children are being affected. So today, for children, teenagers and young people aged up to 24, over 69,000 have contracted COVID so far, of which over 890 of those have been hospitalised. Of those aged 0 to 18, we've had over 38,000 cases in children in that age, and of the 0 to 14 age group, over 300 have been hospitalised. We really need to consider that these are individuals, they're children, they have mummies and daddies who care for them, and we can't just keep looking them up as a statistical point of view. We need to start thinking about individualistic healthcare and individualistic issues, and that's where Aoife came in, and correctly so, that we can't just keep looking and as people as numbers. We need to prevent issues. So I suppose as we're reopening and working with ISAG, an amazing team of scientists who invited me on board, I suppose, to look at things from a different perspective, and working with Parents United, an amazing group of parents and families and students who have spoken up about this. I suppose it's great that we're reopening. It is exciting and it's so hopeful, but we do need to...
One minute left, Olive, thank you.
Yeah, perfect. And I'm finishing up now. Yeah. We need to focus on, I suppose, what does ISAG represent? So ISAG isn't an ideology, it's a set of steps. And it's a set of steps to, I suppose, to protect our health system, but also to support our public health teams. We have always advocated for preventative health. We need to support our businesses. My husband is self-employed and his business has been decimated since this happened. We need to look at retrospective testing and tracing and isolating. We need to make sure we keep those cases down. We need our public health specialists to be more involved in decision making and policy making at a national level and working with those who work in equal rights. We need to focus on targeting our vaccinations for very vulnerable groups. We only learned on Wednesday over 3,500 cases associated with outbreaks in Irish traveller groups just since November. We need to do more to protect those and those in bad working conditions, such as meat factories and obviously our schools. And I suppose we need to focus on airborne, the fact that the WHO have announced it's airborne, and we need to look at ventilation. So altogether, I think ISAG have always supported preventative health and supported our public health teams, and we need to continue to do that while taking individualistic perspectives into account.
Thank you very much, Olive, and thank you for the range of your talk, from your own personal experience to the problems on the ground to what's necessary. And maybe I hope we get a chance to come back to that. The next speaker, our third speaker on 3U Contour, is J.P. McMahon, chef, author and restaurateur, a culinary director of award-winning Galway restaurants, Aoife, Cava Bodega and Tartar Cafe and Wine Bar. He is the founder of the Food on the Edge Festival and an ambassador for Irish food. He has a weekly column in the Irish Times on Saturday and is also a regular contributor to Radio 1 and News Talk, amongst many other activities. Gur míle magat agus tá cid míle fáilte roch JP agus tá cúig nómad agad inis. You have 5 minutes and I give you a warning and you'll have 1 minute after that.
Thanks very much, Catherine. I suppose just to put it in perspective, and I definitely agree with the last two speakers and also yourself as well, that I think I still find, I suppose, a year and 2 months in, or nearly a year and a half, that the approach we have is very, very fragmentary. And even for our own industry, we still have no date whether to begin again. I mean, we have a outdoor dining that is due to begin in June, but again, the provision of that, or it's very weather dependent. So there's a lot of questions around that, and I still feel there's a lack of joint up thinking, even in terms of different groups talking to each other. And I think that's for me, that's one of the benefits of the We Can Be Zero approach, that I don't think it's a black and white approach as being portrayed. I think there's a lot of subtleties to what we can do, and whether that's antigen testing or whether that's tracking and tracing. I feel all of that has gone out the window for this ultimately this vaccination approach, which in and of itself is a good approach, but unfortunately I feel it's just all your eggs into one basket, and if something goes wrong, then we're back to the beginning again. And while I understand we share a border with the UK, that's not to say we cannot effectively control our borders. We've been closed in an ear since December 2019 because we closed for the season and we never got to reopen.
Wow.
And we have about 40 staff to get if we are to reopen. And I suppose our biggest issue in the industry is that without a date, we're just guessing. So I have to hire 40 people now, not really knowing, is it going to be the start of July? Is it going to be in the middle? Is it when are we going to begin? So I do feel if we had a more joint up approach that wasn't so biased, looking at just vaccinations, I feel we would have a little bit more flexibility, because the last thing we want to do is open and then be closed again in September. And it's not because we are we do have supports, and I'm very thankful of the supports that we have, because many countries, I was just on a phone call to a friend in Bangkok where there are no supports for hospitality. So I do appreciate the supports that we have. However, all the supports cannot bolster the morale if you've been closed for a year and a half, or if it goes to 2 years. So what will happen is people are leaving the industry and deciding to do other things, and I hope that doesn't continue, because we are going to have an issue. And Galway depends so much on its hospitality, on the many visitors that travel here for all reasons. And I think that we really need a joint up, coordinated approach to tackle this. That looks at it more than just a health problem. It's a cultural problem. It's a social problem. It has so many different aspects to it, and I find often the thinking around COVID is very one-dimensional, and it doesn't take in the multiplicity of facets that it has been in the ways that it has affected people over the last number of months.
Thank you, JP. You finished under time.
Oh no, sorry.
Yeah, you're way under. Very, very unusual for a man. Do you want to avail of the last 2 minutes?
No, I will. I think I certainly concur with the others, and I think that I'm just adding my points, and I affirm what the others are saying, and that. So I don't think I need to go over what they have gone over, and I think it's just for me. And as you said, Catherine, I think a holistic approach is needed. The narrative is so fragmentary that people are losing faith in that narrative and actually confused about it. And I think even the fact that a lot of the messages that are coming out from NPHET now are positive is also confusing, because they have been negative for so long now. How did they suddenly just turn positive? And everyone's is it just because it's the summer? Is it just because it's an economic issue now? So I'm skeptical about that, and I feel that there are a lot more things need to be answered.
Thank you very much, JP, and hopefully we will have time to come back. So our third speaker is Liam de Brún, Céad Míle Fáilte Róta Liam, and I understand you're in your final week on your sports journalism masters. It's your final year. So yeah, best of luck with that. And I understand you write stories on those who need to have their voices heard. And I can say you'll never be out of work, because there are a lot of voices in this country that have never been heard. And hopefully you'll change that. I'm looking forward to hearing your Donegal accent, because notwithstanding that, I hear that you have strong roots, Galway, and with the Clon and Inisheer on Will. So Céad Míle Fáilte Róta Cuid Nómad agus an sin nómad tar éis an cuid nómad.
Gur míle maióga, Catherine. It's Mr. Liam. I'm 22 and I'm a student. I think what I'd like to thank everyone for what they said so far. It's really inspiring and brilliant to hear other people's stories and experiences. I think what JP said about putting the eggs into one basket is an approach that I personally have seen with the Irish health system through my own experience. And this is, so basically when I was about 14 and going through secondary school, I was diagnosed with depression and anxiety, and I've always been struggling with that my whole life. But when I sort of hit 14, 15, I started passing out a lot, and just randomly I'd be at teen discos, I just see black hit the deck, and went to the doctors loads about it, and they all said, it's just your anxiety, just keep going, it's okay, do mindfulness and meditate and all that. But it does work, but it's always felt to me that there was something a little bit more to it. And so eventually, when I was 18, I went in to get my appendix out, and I remember waking up in the hospital and just seeing my mom absolutely terrified. I was like, oh gosh, this is just getting my appendix out, nothing bad here. But and they found when I was getting my appendix out that I had a rare heart condition. So it's a rare form of Wolff Parkinson White disorder from birth. So basically I had 2 electric pathways on my heart, which made me get really severe palpitations and which was causing me to black out. And then they told me that if I hadn't been spotted, I had a 90% chance of getting the sudden adult death syndrome, which when you're 18 and sitting in a hospital is a bit scary. But anyway, I had an operation to get rid of it. They said it went well, and then they came back and said it wasn't, and I had to get 2 more heart operations. So there was 3 from 18 to 20. So I think that what that kind of taught me was that you're told all these things, that the one solution is always the right solution and you don't need options in health. Like, this is what we're going to do and this is how it's going to help you. Now, from my own experience, that it's a bit melodramatic, but it did almost cause me to lose my own life. And I just think that when it comes to health, there needs to be more options and flexibility. So I'm still high risk, even though my life's not a threat anymore. If I was to get COVID, it would hit me bad because of my heart, and that's not something I particularly want. And I just think that we need flexibility in terms of approach. And as a student, I think it's important. Like, you look at me and you think that's just a student. You look at any student, you think that's a student. They're just healthy, they're young, they're doing their thing. But you never know what's going on with someone. And there's other people who have undiagnosed health conditions, especially young people who don't know. And if they were to get COVID and they hadn't been lucky like me and got a get out of jail free card, that you don't know what's going to happen with them. So I think also as a student, it's important for us to use our voices, especially considering the last 12 months we've been portrayed in an awful light. Every student is made out to be out partying and gallivanting 24/7. I personally have been to none of those, and I'd say about 99% of fellow students would be the same. And even this week, we had the government calling students lazy for going on the PUP payment. I myself am on it because I'm not allowed to work at the moment. So we're being generalized and targeted a lot when most students have done the work. They've stayed home. They've been miserable and they've done their bit and got nothing but hate in response for it. So yeah, my overall point would be that students aren't as naive and idiotic as most people think, and that just to be careful, and that the zero COVID approach is the careful approach. And even if that means saving one life, to me, that's the best thing to do. So I think that's pretty much me.
Gurmila Magad Lehman, under time Gurmila Magad. Agus last but certainly not least, Tá Ciara Ní É agus Aoife Aimíonn go gáithangach. So fáilte kid míle fáilte rót. Ciara is a spoken word artist, a broadcaster, creator who writes and performs bilingually. She has performed across Ireland and internationally in New York, London, Brussels and Sweden. She is an Irish Rights Centre ambassador. She is the founder of REIC Reich, a monthly multilingual, interested to hear more about that, spoken word event, and a co-founder of LGBTQ plus arts collective, Dar Tegel Éireach Atseach Gaelach. Her work has been published in a variety of journals, and her first collection is forthcoming. Tá sé teachtama, céad míle fáilte rud Ciara, cuaig nómad agat.
Gur míle maithagos, Catherine. Ní úsáid mé ach beidir Ciara nóméid, so they couldn't have picked anyone better than Catherine herself to introduce me. Leis na focail is sin fad in my bio. Yeah, it's me Ciara. I'm a poet, and I'm just going to be performing one poem today. It's called Áthas Tógálach, or Infectious Delight. And after all those wonderful talks about the different sides of COVID and how it can affect people, this is just something completely different. It's a poem about my sister's daughter who was born last year, and how it affected us all, well, in a lovely way. Mína nullig an nuri, hánig an tauki. Biog bídach bon jarrig is bug. My sister had a baby, so the baby has us. Fairdeen nullig leraint, a step back in time, all siblings vying for their turn to hold her and behold our new station. It's the birth of an age. We shift up a generation. I pass her to my mother. She brings us closer. Lán dókish. Tágin tex a wam anir a duiarum. Is tussa malan of biog. Is tu gefol. Saulig mugra. Ni eig hi she gejo. She sends us spinning. Mayads a rash a sugra a Ciara buin. Roha Moore until. O veil magur fair, tagin glor ar maher. Ashai ri, changan a lani, a vi fui hu and a gokal ar gri. Frittle ar mamo, on a mamo fein fado. For her, we dust off fossils of knowledge. Relearn the names for foxglove, cockle, curlew. Tomwids a ruhlu, timple is timple, love live, sheer bohurin nis muinte. Is the rare mar a hit in bali court chlor fihe. Dar vagal gan tada ag bun na spére. Cohi in a hamclor lehumwoods, le rihum a will fall to river. And when heaviest I feel this year's bleak numbing drudge, I rush time until the clockwork arrival of her quacking laugh, the tight clutch of her hug. Isha a huv nian ne, na ratamir ti gull. Despite the year that's in it, she reignites our spirit, our vestigial ability to feel each minute. The dark cracks apart, bright slivers glisten, waving at buses, dancing in the kitchen. Titanshi, is Gontep, Shasan Arish. Is she our lochran than Ahale san Avlian? Kay Avai Inti, she's brand new. Who are we? We thought we knew, ach na racunig an fuader a vatan asul, but chasul nach rev an shin ach lach varul. And we're spinning. Infinity is cyclical. These times are strange, but not exceptional. Rugu pashti in amana an chater riav an all. Gerti, triblodi, eigendal. Is ni vai ein chuivne eki an gruachas sho. Skira garid awan in a hashter fada falán. Fecam an ishe, sulis glay a sailray, a sheena asmarark I wad again. A cade law sculla, a cade thuris eanar bus, a cade or I lor slua a curum chalánach kjol, a cade vlashe geir fuishka, a cade fust, a cade fog, singing until sunup, roaming the globe. Mina nullig a nuri, hánig an tauki, biog bídach bon jarrigus bug. Our lochran, our nochis, our solas. Tá sé fad na bacáin fós.
Gur na míle mágad Ciara, sin focail lán de dóchas, focail a thugan ordu manma, agus focail a cuirdan béim an rud is tábhachtaí ina rire, Rocha Mór an tíl, agus tá tauki agan, gur míle mágad.
Gur míle mágad.
Now, gur míle mágad, thank you to all the speakers, and we have just under 20 minutes left, and some very good points have been made, so I hope we'll have a lively discussion. So if any of the speakers want to come back in, I'd like to go back in to something that, well, I mean, everybody has made points, but JP has made the point about the fragmentation, and it's something that has jumped out at me from the beginning. We went from being all in it together to utter fragmentation in relation to how we're treating different groups in society, to a fragmentation in relation to the overall debate we have. we're not having, and the absence of a pathway out of this, and we're back to rolling lockdown. So I just preface it by saying that. So feel free, any of you, to come back in. You've all been under time, so you're a meal and mug, and it's left us plenty of time for questions and answers.
Yeah, I can just add, Catherine, and I'm sure from inside the Dáil, you might have a different perspective on it. But I think the ways in which the news has been released, I think, has been possibly the hardest. You know, where stuff is released either through the newspapers or on social media, and I feel that the narrative itself has kind of run away from the government, and there is no controlling it. And so there's either all or nothing. And so either nothing comes out or everything comes out. And I really think that the fact that we don't have, we possibly should have had a department for COVID or something that where we created something for the duration of the pandemic, or a minister for COVID, because unfortunately I think it seems to be in everyone's pocket, but at the same time it's in no one's pocket, and there's no one person accountable. At the same time, sometimes it is Neffin in the driving seat, and other times it's not. So I think that's probably been the hardest and the most mentally straining, I think, is the ways in which we've been receiving the news.
Yeah, thank you. Yeah, I agree with you, and I'm part of that process, and some blame has to attach to all us politicians. But we have struggled from day one. I certainly have tried to speak out. It's not about me, but I agree with you about the narrative. It has become about the narrative as opposed to society, a pandemic, and how best to deal with it. The role of vaccinations within that, with an overall plan and clarity. I agree with you. Any of the others? Yeah, sorry, go ahead.
No, I was just going to say, and even I think it builds distrust, and now when you listen, like even when I listen to the vaccination numbers and the amount, and like there is no objective sense of like whether or not, because you hear stories, and that they have people who are under 60 registering, but I still know people who are 65 and 70 that have not been vaccinated. So it does build distrust in you when you listen now and you go, I actually don't know what is the truth and what is not the truth, with regard to where we are exactly. And that is, I suppose it's up to the government to try and come out and to try and to try and detail those things.
Yeah, just before I go, I agree with you about trust, and that's the most basic element for a democracy to work. My own trust has been shattered. And if we look at vaccinations, for example, the group from 60 to 69 were told they would go to the bottom of the list. That type of approach does not build trust. So I might come back at the end. And did anybody else want to come in?
Yeah, I'll just come in to say that, we've had, I suppose, I think that trust is hugely important, and we did go from a stage of we're all in this together to we're kind of all apart to now complete division, I suppose, among sectors. I mean, from my own perspective, I would say government have caused a division between, let's say, schools and businesses because they've changed vaccination programs over and over again. We do have this huge problem that we do need to support, or that we do need to fix. And I suppose, thinking about it from an ISAG point of view, it does come back to public health, where I think many of them have been left out in the dark, and they have not been supported over the years. We know this. We should have been prepared for this. As you said, a minister for COVID. We have a minister for health. And we've had two of them in the lifetime of this pandemic. Where it comes from is, we should have always had those things in place ready for this. It's not as if people didn't know. As a kind of serious issue in relation to businesses, my husband was an essential business who had to remain open. He relied on hospitality sector. He owns a dry cleaners. So most of our business would come from hospitality, restaurants, hotels, and hairdressers, barbers, so on. But he was essential, left open with no business. So we also had to provide all the services there. I think we need to look at how do we actually open up, safely. And the way to open up safely, which is what we're opening up now, is it's safe in my perspective. I wouldn't say it's very safe because we don't have enough vaccinated, but we really, really need to do retrospective testing, tracing, isolating. We need to support our public health teams to be able to do that. They have to be involved in decision making, policy making at a national level, not just locally or regionally or in assigning one person. We need to really get behind our public health teams, and for people to understand what public health is. It's preventative health. That's what public health is. And they're reactive when they need to be, such as our close contact tracing and so on and so forth. We really do need to focus on our vulnerable groups. So, we can look at sectors as in the amount of cases, but all our vulnerable groups are within those sectors, and a lot of them work in very low income kind of work environments, and we really need to protect them as much as we possibly can. We've never done it properly as a country. We have an opportunity to do that now. And I suppose the biggest message, if we could do anything to support our businesses right now, is to inform them of the absolute importance of ventilation. So if businesses want to stay open safely, they need to know how to best ventilate, how to monitor that, keep all those windows open, keep it safe, so that businesses don't end up closing again and we don't go backwards. I'm excited. You can see by my hair, I look terrible. I can't wait until we get there. But we really need to be very practical about this, and ISAG has always had steps to do this, and I think now we need as a community, an Irish population community, and our politicians to come together to really start advocating that it's always safety first, and we bring it all together. And I don't know if that helps to the conversation, but it's definitely something.
Maybe you could tell us just a little bit more about ISAG.
Yeah, ISAG are a group of scientists, not just Irish. We have scientists from across the world who are involved in it. And they have, from the very beginning, advocated for, I suppose, preventative health. And one of those has been, a zero COVID approach. What we've had in Ireland so far is we've allowed variants to come into our country. As an example, last June, we had 61 cases. We got down to 61 cases from 5,500 cases in less than 12 weeks. In less than 6 weeks after the government announced reopening, on that date, we were in our second wave. And that was nothing to do with the public. That was to do with the government deciding to reopen like we were without proper measures in place. So ISAG have always said, if you can stop those variants coming in and stop them circulating around our country, that we can actually have a sustainable life and our businesses would be open and be sustainable, like we've seen in many countries across the world. The team themselves are diverse. They think about things from lots of different perspectives, including human rights and equal rights. They're very proactive, and I suppose they've been out there in the public fighting for a long time to ensure our public health teams are supported, and they will continue to do so. They're not going anywhere. They're staying where they are, and they invite people like myself and students in to their teams, recognising the importance of people who aren't of the traditional science or mathematical background.
Thank you, Olive. I might come back to you on where you think zero Galway is going to. But Liam, had you your hand up, Liam, to come in? No, just by accident.
No, I don't think so. Okay. Sorry.
Yeah. Ciara, did you want to come back in? Just to indicate if you do. Yeah,
no, I'm fine, Margaret.
You're fine. There are questions coming up here in relation to who's in charge, and JP has raised this, and I think we have enough ministers, and the Constitution sets out how many ministers. But the point you're making, I agree with. We need somebody in charge. Now, if I say too much, I'm a chair and I'm chairing here. But I'll give my opinion. See, nobody's coming in at the moment, and feel free to disagree with me. But I believe we started off well. Remember, we've had two changes. We've had a change of government as well as change of ministers. And I think the vast majority of people in Ireland have done extremely well. I think I'm indebted to them. It's the leadership that has been lacking, in my opinion. It has been split and fragmented. And I think there's an absence of an overall plan from day one, and now an acceptance of rolling closures, which to me is totally unacceptable. I feel we should have had from the beginning a zero approach with proper testing facilities, ongoing, and a proper quarantine, not one that was designed to fail, from the very beginning, with the view to giving a clear message to all our citizens. I don't think we put vulnerable people first. I think we thought about them last, actually. It was quite obvious, congregated settings and so on. So I could go on, I won't. I'm wondering, where are we going now? I mean, we can be zero, is up here in front of me. Can we still be zero? What is it we need to do now? What can Galway do now? Yeah.
Yeah, but I suppose that as Olive said there, like, I do think we need to start bringing back measures that we had introduced that seemed to have disappeared, whether it was track and tracing, even the app that like nearly $1 million was spent on, that now seems to be never mentioned at all. I think antigen testing as well, even whether it's in the workplace or to try and bring that in, because as could be seen in other countries in Europe, you can start to do things with safe measures and tests, but at the moment we seem to just be in free fall. And also I think, as Olive said, it's important to mention the other businesses, like a lot of the farmers that I would know whose main source of income came from restaurants have got no support whatsoever because they're still open, but they don't have any customers anymore. And unfortunately, they have just fallen through the cracks. And so it's certainly not a case where grants and subsidies have been divided equally. And I know plenty of farmers, particularly shellfish farmers, that have suffered because the international market is gone as well. But I do think that the quarantine, as you said, Catherine, I think we need a more robust quarantine. And I don't think it's about, I think I saw a report today, it's not about stopping hauliers or about stop. I think that there are low punches, are very easy targets being hit when you ask for a proper quarantine. But I don't think I think any country should be able to uphold a proper quarantine at the moment and still let essential stuff in, whether it's food or medical supplies or all of these things. And New Zealand didn't break down, or Australia, when they implemented these things. I know it will be more difficult, but just because it's more difficult does not mean we can't do it, or does not mean we can't do aspects of it where we can at least limit. Whereas at the moment, it seems to be still a free-for-all with people traveling to whatever country they want.
Thank you, JP. Did you want to come in, Olive? No.
Yeah, no, I completely agree with JP, and I would say that we also need to stop putting the blame on either people or cohorts of people, such as students or young people. We need to stop doing that immediately, because remember, we don't have really good messaging. So as part of mitigations, as JP mentioned there, we need to also look at our messaging. So the current message out there is young people don't get sick. The current message is schools are safe. We know internationally that schools can only be safe if they have the proper mitigations in place. And in Ireland, unfortunately, we're not hitting the bar high enough when it comes to that, especially in relation to ventilation. What I would say is, I suppose, going forward, just because it's hard, it doesn't mean you shouldn't do it. I think that's a very key take-home message. We are going to have, unfortunately, more pandemics in the future. It's not the first time it's happened. We've had lots of them. We need to really start now pulling together, the bones of what's happened, learn from what's happened, move forward. And we need to be very transparent in our data, which is very poor at the moment in relation to children in schools. And we also need to be more transparent in our messaging. We need to get more, I don't like using the word aggressive, let's say assertive in our messaging. COVID is dangerous. It can harm anybody. Long COVID is real, and we don't want that as a risk. And we need to really get in behind our SMEs and our local communities and our families. We can actually do it if we have the willingness to do it, to actually get there. But it does take work to do it. I think collectively we can.
And I think as well, I think our health system needs, as you will know, Catherine, needs to be overhauled. And I think one of the reasons why Ireland has been affected more than, say, other countries such as Denmark, where I have friends, is particularly our health system is already full of holes. So once you put COVID on top of that, everything starts to fall apart. And I think even the fact that the vaccination process has no kind of digital certification at the moment. I mean, whether that's going to happen at your second one, I mean, I don't know why it wasn't thought through initially. If you're going to vaccinate X amount of million of people, we have phones. You can show that you've been vaccinated. People are getting pieces of paper at the vaccination center to say they've been vaccinated. And I think our health system should be working a lot better for the resources that we put into it. It's not like it's underfunded. You know, I think it's just there is a lack of accountability, and there is just, I think, far too many levels of administration that passing through it. And I think that's what we really need to almost begin again with the Department of Health.
I think we all have a role in that, really. And I had 17 years at local level, and I sat on a health forum meeting. I watched the dismantling of a public health system. So I think we all have a role in who we choose to put into the Dáil and what we want as a nation in terms of a civilized society. You know, there are basic things: public health, public education. And if we come back to what Olive said, we started with public health system that was completely under-resourced, which is one of the main reasons why we weren't prepared for the pandemic, in addition to our infrastructure. But there was more than one report on public health and the deficiencies. We need to act on that. I clearly agreed with. What do you think about taking a more local approach? It's something.
No, absolutely, and I do think that, as Olive said, the SMEs are the lifeblood. And if you look at the companies that have benefited in the pandemic globally, they have been major players. And it's not to say that I never buy anything on Amazon, but it's just that at the moment there is a lack of balance. And unfortunately, you have the majority of independent SMEs closed, whether they're restaurants or hairdressers or shops. And the larger ones are I suppose oblivious to the effect of the pandemic, and this will we don't even know at the moment the effect of that. It'll be 6 months or a year where we realize, there'll be a decimation. I mean, I presume when we reopen, if we reopen in the summer, there will be a honeymoon period of 2 or 3 months where we all get excited, we all go out. But it's after that honeymoon period that I'm worried about, where if we don't have international tourism, or we have another recession, that's what's going to cripple the local economy.
Yeah. Thank you. We're drawing near the end. If anybody wants to make a quick comment. Yeah. Aoife, you're back.
I came back in. I've been watching. I've just been lying down and I've been watching on my phone. I just wanted to come back in and just say that what you've said, JP, and what you've said, Catherine, in relation to leadership, and someone kind of taking the reins and taking kind of looking for an actual solution, or various solutions depending on the sector. I think that's important. All of you mentioned there is about practical issues of how you can reopen and how we can do this in a very safe way, even if it is difficult. But one thing I did want to say in relation to health, and that is that we're the patients, being a patient advocate, someone who has long COVID, we need to be at the table here somewhere too, because I have to say I feel very left out. It's kind of like they say, oh, we're going to leave this to the experts, we're going to leave this to the medical profession. Actually, I'm the expert. I'm the one who's living this every single day. And I suppose it's just kind of, that's why we kind of part of Long COVID Ireland. That's why it kind of came together, because we need to be heard and we need to be listened to. I think, nothing about us without us kind of thing. So that's all I wanted to say, because I know I went way over my time, but it's been a wonderful discussion, and thanks very much for having me.
Thank you very much, and it's coming to a close, and I know Susan is going to come in. Thank you very much. It's been very good for me, actually. So I want to thank We Can Be Zero for organising it, and Sinead and Susan, because it's helped me as well. I do believe, and a comment came in there, that we didn't take the difficult decisions in the beginning. I think the people of Ireland did. I think they did comply with everything. The leadership didn't take, on the basis that, I don't know. and we've had a series of rolling closures. I do believe we have to go local. I do believe that. A comment came in about green Galway. I agree totally. As a COVID-free Galway, and also our public health system has to be resourced and dealt with regionally and locally. So Garmila Magev Galir and Oreshka Susan. Back to Susan. Yeah.
Thank you so much, everyone. Yes, we're going to draw to a close now. Just want to say on behalf of Galway Can Be Zero and We Can Be Zero, we're so grateful to all of you for giving us your lunch hour and sharing some very personal stories, as well as a lot of really useful information. And Catherine, you're so busy, so giving us your hour, we really appreciate each and every one of you. So that's it. We'll wind up. Hopefully we'll do something similar again in the future. But in the meanwhile, have a good, happy, safe and healthy, hopefully, weekend. And thanks all for coming.
Thank you very much, guys. Bye, bye, bye.